According to the National Breast Cancer Foundation, 1 in 8 women will be diagnosed with breast cancer in their lifetime. We are less than a week from October, and that is Breast Cancer Awareness Month. Doctors say treating breast cancer as soon as it's discovered is crucial. So we have Dr. Tasia Pusarla, a medical oncologist at USA Health, to talk more about this important subject. We're going to hit on the symptoms for breast cancer and also the new treatments. I thank you so much for coming in.
Of course, it's my pleasure.
So let's jump right into it because we don't have a lot of time. Talk about the symptoms of breast cancer.
So one of the most common symptoms that you get from breast cancer is usually a new lump or a mass that's found in the breast. It's usually painless or has irregular edges and can have, and is usually one-sided. But other signs and symptoms that you should look out for, or if you have any change in size or shape of the breast, if you have a pain in one of the spots and it doesn't go away, if you have thickening of the skin or redness or itching of the skin and it doesn't go away as well, or if you have any nipple discharge that's new, or pulling in or changes in the nipple, these are all signs that you should be looking out for. And if you have them, it's very important that you get them checked out by your primary care doctor.
And also screening, that's where that comes in, right? You got to make sure that you're getting that testing. It's preventative.
Definitely, definitely. So the recommendations currently are if you're between the ages of 25 and 40 and you're a woman, you have to get annual breast exams. And then if you're above the age of 40 to 75, then we do recommend getting an annual mammogram. And then obviously if you have a strong family history, then you have to get it 10 years before your first family relative gets diagnosed.
And I've seen a lot of women kind of celebrate getting their mammogram, no longer afraid and thinking, oh, it's going to be uncomfortable, it's going to hurt. You see all these pictures on social media, you know, like, yes, I did it, I'm taking charge of my health.
Definitely. And I think that's very, very important because, you know, before I think most people have the stigma that, you know, getting mammograms is very painful or they get exposed to radiation. And most people don't know that, you know, a mammogram is equal to getting a chest X-ray. It's the same radiation amount as that, or the same as you get around your natural surroundings. And you know, early detection is one of the best ways to prevent and cure breast cancer. So.
And on that note, I want to delve a little bit into treatments because I know we're always making advances.
Definitely, and I think being in breast cancer field right now is very exciting and it's very new. There's a lot of new therapies that are happening right now. One of the big things is hormonal therapy. So if you have hormone receptor positive breast cancer, you no longer may need chemotherapy and you can just get this treated with just by a pill. So which is very exciting for patients and us as well.
And I imagine your doctor would let you know if you're a candidate for that.
Oh yes, definitely. So that's one of the first things that we do is to check for if you have any of those hormone receptor positivity. And if you do, you'll be a great candidate for it and you wouldn't have to go to chemotherapy. So.
But it has to be discovered, and that's where making sure you're getting checked regularly comes in.
Yes, definitely. So if you feel that new lump or mass, or if you have any changes, you know, get your OB-GYN or your primary care doctor to take a look at you, and then come over to the South and get that mammogram.
There you go. I appreciate you so much. Thank you for coming in. It's such a treat. And we're going to have all of this information posted for you on our website so you can watch it and share it with someone you know. You can look for it shortly at fox10tv.com.